You know, we usually think of severe stress and anxiety as something that only strikes the young and overworked. But welcome to this explainer, where today we're going to uncover the hidden biological mechanisms of a condition that completely shattered the life of a 63-year-old retired man. The reality of what actually happened to him? It's much more complex and, frankly, absolutely fascinating.
Seriously, ask yourself, what in the world links a newly retired office worker to sudden, terrifying physical symptoms that send him rushing to the emergency room only for doctors to find absolutely nothing physically wrong? Picture this. You're sitting in your living room, finally trying to enjoy your hard-earned retirement, right? And out of nowhere, your heart is literally pounding out of your chest. You can't catch your breath. The very thought of stepping outside your front door fills you with this absolute, paralyzing dread.
Just imagine the sheer confusion this guy faced. I mean, after a lifetime of working in human resources and administration, he retires, struggles a bit to find a new role, and suddenly starts losing sleep. Then, boom, intense hyperventilation and dizziness just hit him. Thinking it was maybe male menopause or a failing heart, he desperately bought tons of health drinks and supplements. He was even bulk buying things like Yakult, and he repeatedly called ambulances. But every single time the paramedics arrived and every time he went to the hospital, he was told his body was perfectly fine. So what on earth was actually happening?
Well, the shocking reveal is that this 60-something man was actually suffering from panic disorder. It completely proves that this intense condition isn't just a young person's issue, no way. When the daily routines of decades suddenly just vanish and a real loss of identity sets in, that compounded exhaustion takes a massive, massive toll. The mental strain can actually manifest in incredibly violent physical ways.
So let's look at part 1, the biology of panic, or when the nervous system gets stuck in overdrive.
To really understand this, we've got to look under the hood of the autonomic nervous system. Think of it exactly like driving a car. The sympathetic nerves act as your body's accelerator. They drive activity, energy, and tension, getting you all revved up for the day. On the flip side, the parasympathetic nerves are the brakes that help us relax, digest, and actually rest at night. Normally, these two systems trade off perfectly in a totally natural daily rhythm.
But here's the catch. A panic attack happens when chronic exhaustion causes that sympathetic accelerator to just get permanently stuck. In our retiree's case, the sheer fatigue from his insomnia and the intense stress of a massive life change pushed his nervous system way past its peak. It basically short-circuited. It overloaded his body with physical symptoms like dizziness and cold sweats, along with this primal terror that you might actually die, even though physically you are perfectly safe.
Which brings us to part 2, the vicious cycle. This is how a single attack evolves into a long-term disorder.
Now, it's really crucial to understand that having a single panic attack doesn't automatically mean you have panic disorder. Honestly, anyone can have a single attack if they're pushed to the brink of extreme exhaustion. It becomes a disorder when it spirals through 3 distinct steps. First, you have the initial attack itself, but then comes step 2, anticipatory anxiety. This is a state of hypervigilance, right? It's a constant, crippling fear just waiting for the next attack to strike. And that inevitably leads to step 3, agoraphobia. The person completely avoids enclosed spaces, lines, crowds, or in our patient's case, simply going outside, all just to avoid triggering another terrifying episode.
Let's move on to part 3, differentiating the diagnosis. We're untangling panic disorder, depression, and adjustment disorder.
Because mental health symptoms so often overlap in this confusing web, we really need to clearly categorize what sets panic disorder apart. It's totally vital to get the label right so doctors can tailor the best approach. Take adjustment disorder, for instance. It's tied to a specific external stressor, like a highly toxic workplace. Remove that stressor and the symptoms usually clear up. Depression, on the other hand, is more of a brain-based condition marked by persistent low moods and a deep loss of energy. But panic disorder, as we've just seen, is distinctly driven by a nervous system essentially short-circuiting from pure exhaustion, which is what triggers those sudden, violent physical symptoms.
However, medical professionals are quick to point out that in the real world, things aren't always in neat little boxes. A patient can easily have overlapping conditions. You could have underlying depression that's suddenly complicated by severe panic attacks, or vice versa. The human mind is incredibly complex, and the boundaries between these conditions can often blur quite a bit.
Finally, we arrive at part 4, the road to recovery. These are the medical and therapeutic strategies needed to win the long-term battle.
So, with the mystery solved, how do doctors actually treat this? Well, they utilize a really powerful two-pronged medical strategy for what is often a pretty long-term battle.
First, they prescribe SSRIs to gradually rewire and calm the brain's baseline anxiety levels over time. Alongside that, they provide fast-acting anti-anxiety medications. Think of these as a psychological amulet, a handy way to manually hit the body's brakes during a sudden attack. But doctors urge extreme caution here. These anti-anxiety meds require very careful use because they carry a high risk of dependence if relied upon too heavily.
But here's the thing. Medication usually isn't enough on its own. Cognitive behavioral therapy, or CBT, is absolutely essential for a lasting cure. It starts with objective observation, essentially training patients to step back and rationally say, okay, I am having an attack, but I won't die. Next up is exposure therapy, where the patient slowly, safely steps back out into the world, gradually facing the places they fear. And finally, cultivating a flexible mind. This means abandoning that exhausting 0 to 100 perfectionism and learning to gracefully let go of unnecessary stress.
Ultimately, the specific medical label matters far less than a doctor's compassionate understanding of a patient's unique life journey. For our 63-year-old retiree, true healing didn't just come from a bottle of pills. It actually came from someone understanding his background. A man struggling to find his purpose and a new identity after a lifetime of hard work, rather than just treating him as a set of symptoms to be medicated.
To wrap up this explainer, I want to leave you with this provocative thought. Considering how easily sheer exhaustion can short-circuit our nervous systems and trap us in a vicious cycle of fear, what steps can you take today to ensure you're actually giving your body the rest it desperately needs? Are you listening to your body's brakes before your accelerator gets stuck? Keep that in mind this week, and I'll catch you on the next explainer.